Tay-Sach's disease, also called GM2 gangliosidosis, is a rare inherited metabolic disorder by which certain lipids accumulate and progressively destroy nerve cells in the brain and on the spinal cord. It is recessive, inherited autosomally, and is a chromosomal mutation located on chromosome number 15. Symptoms include, but are not limited to, muscle weakness, problems with coordination, rhythmic muscle contractions, stiff muscles, spasticity, feeling faint or wasting away, dysphagia, hearing loss, seizures, vision loss, and impaired voice. Usually, symptoms arise within or around 6 months of age, and the average life expectancy with this disease is around 4 years, though in rare instances, affected persons have lived up to the age of 13.
Risk of carrying. Very rare, less than 20,000 cases in the U.S. per year. You are more likely to be a carrier of this trait if you are of Eastern European Judaic descent, a 1 to 27 chance.
Current treatment options. Medication. To reduce symptoms, a number of prescription medications are available, including seizure medications. Respiratory care. Children who have Tay-Sach disease are at high risk of lung infections that cause breathing problems and frequently accumulate mucus in their lungs. Respiratory therapists can reduce the mucus using chest psychotherapy, aka CPT, and in training family members to provide CPT to the child's home. Feeding tubes. The affected child may develop respiratory problems by inhaling food or liquid into the lungs while eating. To prevent those problems, a doctor may recommend an assistive feeding device such as a nasogastric tube, which is inserted through the child's nose and goes through the child's stomach. Or a doctor trained in stomach surgery may surgically insert an esophagogastrostomy tube. Physical therapy. As the disease progresses, the child may benefit from physical therapy to help keep joints flexible and maintain as much range of motion as possible.
Diagnosis of this disease involves a doctor or nurse examining the baby and asking questions to the parents regarding its family history. If determined necessary, tests that follow may be, but are not limited to, an exam of enzymes in the blood or body tissue for hexosaminidase levels, or an eye exam that, if positive, would reveal a cherry red spot in the macula.
New promising treatment research. Jacob sheep model. A rare breed of sheep known as Jacob sheep has been used as a model in the research of Tay-Sach's disease. Due to their susceptibility to the disease, the pathophysiology and the specific gene mutation of the disease are virtually identical in humans and the sheep, which advocates for the use of the animals as a research model. Cord blood transplant. Used to treat genetic metabolic disorders in babies while they are still in the womb, is a method which uses a small select number of therapeutic stem cells injected directly into the fetus abdomen at 12 to 14 weeks of pregnancy. The ideology of this procedure is to give the baby cord blood stem cells from a healthy donor, with the potential to provide healthy genes that will hopefully replace the genes that aren't working in the baby cells. There is a pilot trial currently open to pregnant women at risk for having children with fatal metabolic disorders, such as Tay-Sach's at Duke University. Substrate reduction therapy is a technique that involves the use of enzymes to increase the catabolism, or breaking down, of the GM2 gangliosides in the central nervous system, substituting the role of the missing hex A enzyme. The aim of this treatment is to prevent the accumulation of the lipids and prevent the symptoms and progression of Tay-Sach, with the possibility of halting it altogether.